My name's John Loy. I'm a consultant bariatric surgeon both at the Homerton NHS Hospital and the BMI London Independent Private Hospital. I've been a consultant bariatric surgeon with Healthier Weight for the last 5 years, and I offer the full range of bariatric procedures including gastric balloons, gastric bands, gastric sleeves, gastric bypass and revisional surgery. My primary practice is mostly gastric sleeve and gastric bypass surgery. I also offer revisional surgery for patients who have maybe had surgery abroad and it hasn't worked out how they've expected it to. And also we offer gastric balloons for people who don't want an invasive procedure. So I'm originally from County Down in Northern Ireland. I grew up on a farm there, a small family pub as well. I went off to medical school, the eldest of 6. 4 of my siblings have followed me into the same game, and I started medicine in 1997, graduated 2002, spent my early years working around Belfast. Due to my bariatric interest, I moved over to England in 2008 and was lucky enough to work in the southwest of England, New York, Shrewsbury and now London. Oh, London is the best city in the world, and I even say that as an Irishman. London has provided me with opportunities to develop my bariatric practice in both the NHS and private sectors, and we believe if you want to have bariatric surgery, some of the top bariatric surgeons in the world are here, and you can come to London, have really good surgery and superb aftercare. So my interest in bariatric surgery started as a registrar in the Bristol Deanery. I was fortunate enough to have bariatric training in Taunton Hospital with Richard Welburn, David Mann, and they were the trailblazers for bariatric surgery in the United Kingdom. I've been a consultant surgeon now for 5 years, firstly at the Royal Shrewsbury Hospital and latterly in the last 2 years at the Homerton University Hospital. And that move to London has allowed me to develop my research interests into fatty liver disease. Currently, at the Homerton Hospital, we are recruiting patients into a major study looking at the effects of bariatric surgery on fatty liver disease. I'm also involved in teaching third-year medical students for Bart's Medical School and in charge of their special study modules in bariatric surgery. Bariatric surgery is so exciting. It's a really exciting specialty to be involved in as a doctor and a surgeon. It's a relatively young specialty. We're finding out more and more the indications for bariatric surgery and the benefits of it to the patient. We've changed public perception about bariatric surgery. We know that obesity is not people's fault. We live in an obesogenic environment. So it's very easy for us to become bigger and bigger and bigger. And that's due to societal changes. My thoughts on where we're going with bariatric surgery is that it should be offered as a tool, as one of the many weapons we have against obesity and the enlarging population. I think there will be further developments in bariatric surgery in terms of reducing the invasiveness of the surgery over the coming years. So when patients ring Healthier Weight and they get an appointment with me, I consult with them here on Harley Street. We have a discussion centred around the person. And it's not just about their weight, it's about their lifestyle, about their expectation for surgery, about their hopes, their dreams, their aspirations, and why they've actually come to see me. And it's really important that I find out about that person and not just someone who may be overweight. And together we'll make a plan, and if the patient wants to go for surgery, I then offer them surgery at the BMI London Independent Hospital. The BMI London Independent is a fantastic hospital. It just had a very, very good rating from the CQC, very good in every field. And I've been operating there for the past 2 years, and we've got a great working relationship with the theatre teams, the ward teams, and my patients are very happy having surgery there. So when a patient comes to see me, it's really important that I establish a relationship with that patient. And I want to find out exactly what it is you want from your bariatric operation. If it's just simply to become thin, well then we have to look at other reasons. We have to say, well, it's actually to improve your long-term health. That's the fundamental reason that we do bariatric surgery. So it's really important that I establish with you as a patient your reasons for looking for surgery. And then together we can make a plan. In some instances, surgery is not quite right. And in that situation, we are able to say there are other options for you. But in the scenario where surgery is indicated and it's appropriate, and both you and I agree that surgery is the right way forward, then we'll sit down and decide which operation, We'll perform that operation to the safest and highest standards, and then I will make sure that you are looked after in the post-operative period so that you achieve the result that you want. I believe that the Healthier Weight team offer our patients the best pre-operative workup, really safe surgery of high quality, and most importantly, the aftercare. So patients after they have surgery will see me in the perioperative, post-operative period, and then will be followed up by me at a 6-week follow-up appointment, and then with our bariatric dietitians and nurses, and of course at Healthier Weight, if there's ever, in the rare event, a problem, we will always see our patients back. So patients come to see me and they're understandably nervous, and they think surgery is a really major step, and it is a major step. But you have to say to patients, it's safer for me to perform bariatric surgery on you than to continue with the heavy weight that you are. That heavy weight will bring with it diabetes, sleep apnea, an increased risk of cancer. Obesity is now the second cause of cancer in the United Kingdom after smoking. So obesity isn't safe. And when you weigh up the risks of being obese and continuing to be obese and overweight versus the risk of surgery, there is no competition. It's much safer to undergo a keyhole procedure, to have bariatric surgery, than to continue to carry the weight. So a lot of patients think that we do major surgery through a big cut in the tummy, but that's surgery of yesterday. Today we perform bariatric surgery through 3 or 4 small, tiny little keyhole cuts. Most of my patients leave hospital on the same day if they've had a gastric band, or on the first day after surgery following a sleeve gastrectomy or a gastric bypass. It's the least painful surgery that I do. Patients are up walking about that afternoon, the same afternoon with our physios. There are no drips, no tubes, no drains, no catheters, and 3 or 4 small little cuts with dissolvable sutures. And for me, it always amazes me that we've done this really quite wonderful operation in the tummy to rearrange your insides, to cure your obesity, and you're up walking around within 2-3 hours. And this always surprises patients. Yes, you will have a little bit of bloatedness or gassy pain after the keyhole procedure because we blow gas into the tummy. But all in all, a couple of paracetamol, a couple of cocodamol, and that's all it takes.